100%.
Good morning.
Okay, guys. Before we start, does anybody have any questions?
No.
Nope.
Okay, guys. So ST, is okay. Let's get done with chapter number 4. Okay. And this one here is right. Okay, good. So maybe it's okay with 5. Okay, so it says okay, prefixes. Great. Now the first one that they talk about is E or N. Now they both meant no, not, without, and we can say it's okay, roaring, it's okay, I mean, it's okay in the absence of. And the rule was that, okay, yes, if your root word starts with a consonant or consonant, you're going to use A. If it starts with a vowel, or you're going to use N. Right, okay. Good. So we can see it's okay, A. Nia. Now, although it's okay, we write the P, but this is silent. No, sorry. That's what this is. Sorry. but it's going to be pronounced as app, and then you go near. Okay, so that's how it's okay the pronunciation goes. Okay, so it's going to be apnea. Yeah, where practically it's okay the word, or actually it's okay the word near, actually it's okay was ear. Okay, but in this case, yes, okay, it's going to refer to breathing. So apnea is going to be as okay, what we can call it okay that there's no breathing. Okay. Common, not common, but it's okay. Because a common type of apnea is what people call is okay, sleep apnea. Okay. Either it's okay, before it's okay, going for it's okay, what you want to call it, CPR. Okay, you mainly will see okay as the patient is not breathing. So that is going to be technically referred to as apnea. Okay. This can also happen in what you can call as okay respiratory arrest, which may mean that okay as the respiration or the breathing has stopped. Right, okay. Okay. So when we are at A, in this case, yes, okay, that's going to be that there's no breathing. Bad, okay, guys. If we just took okay as another, and we say this near. Now here is okay, sorry, it's okay. That's when you write the P, but it is going to be silent. Okay. But this near here is okay, or this mean in this instance here is going to mean as okay. Difficulty in breathing. Okay. We also said A, and the reason that we use A here is because it's okay, our rule word is okay, starts with a consonant, which is going to be as okay, aphasia, which mainly means as okay, no, and fast is going to as okay, we speak or speeching. And me is okay because it said E, that's just going to mean okay, this whole word here is a condition. Okay, whereas okay, you go and say aphasic, then okay, it just becomes just okay pertaining to aphasia in this case here. Did that make sense?
Yes.
Now we can take another one. And we can say it's okay. A, which again it's okay means it's okay, no or none or absence of. This just becomes just okay. The E, I mean, yes, okay, in the case that we have it becomes a condition. And when this says okay, MNSE or MNES, sorry, is going to use okay, be memory. Okay, so this is what we mainly as okay, just simply as okay can translate into as okay, memory loss. Oh, it's okay, I don't remember anything. Okay, so a technical word for is okay, loss of memory is what we can call it, okay, amnesia. And again, it's okay. Here it's okay as far as the pronunciation is concerned. Yes, okay, it's going to be the A and M will be pronounced together. So it's going to be amnesia. Is that clear?
Yep.
Yes.
Okay. Now we can, it's okay, say for instance, another E. Okay. Which means it's okay, no. And okay. The other term that we actually put will be as okay. Coffee, where okay, as the Y here indicates that okay, as this whole thing here is a process. Okay. Which become as okay, atrophy. And now what the word trophy actually will be is okay. The trophy meaning is okay, will be is we can say is okay. Yes, that's okay. Not real, but that's what you have okay, producing new cells. Okay, so we can say it's okay when no new cells are being produced, that whole phenomena is going to be called atrophic. Okay, atrophic. Okay, did that make sense?
Yes.
Good.
Yes.
Good. Now we can just go to some of our yes, okay. A couple of terms that may is okay start with a vowel. And I hope guys, you guys are good with this one here. Anemia, right? Clear? Okay. We can have okay as another one, and we can say okay. Now here that's the N, which means no or without or loss of. And our word is going to be as okay, orex. And we can say it's okay, ear. Well, okay, the ear mania is okay, indicate that this is a, sorry. In this case, okay, it becomes as okay, a condition. And the orex mania is okay, what does this mean? Sorry, appetite. Okay. So anorexia mania is okay. This is the condition in which the patient is okay, loses his or her appetite. Okay. They just call, for instance, okay, a box known as okay as eating disorders. Okay. And okay, the common type of anorexia is what they actually is okay, completely as okay, or totally will call as okay, anorexia nervosa. Okay. So anorexia nervosa, that's mainly as okay that the patient as okay that the patient as okay may stop eating. Or even as okay if he or she is okay eats, as okay, they may as okay forcefully as okay afterward induce vomiting mainly as okay to vomit the food out. Why? Because of being nervous to become as okay gain weight. That's pretty much okay what is behind it. Did you guys get that?
Yep.
Good. Now we can just go on to the next term. And that's going to be AB, which means that's okay. We can say it's okay where B, away from. Now that mainly is okay, just two terms that we will use here. One is going to be as okay what we will call as okay AB, which means it's okay, you can just say it's okay or mean away. And then it's going to be as okay, just going to be attached to the word abduction. Okay, so let us just say it's okay, what is abduction? Well, okay, we can mean that would mean it's okay, means to take away or move away. Okay, but this is going to be as okay a movement. Primary as okay, we can say it's okay associated to your limbs. Now it's probably easier just okay demonstrated in the case of just okay your upper limbs. Because okay, if somebody is okay standing like this, and okay, he or she is going to is okay, we can say it's okay, perform what we can call it, it's okay, abduction of the upper limb or arm. That may mean that okay, he moves his arms like this. So this is going to be as okay when the arm, for instance, okay, is abducted. Is that clear? Oh, yes, okay. Right now, yes, okay, my arms are pretty much okay down the side. But if I go like this motion here is called abduction. Clear? Okay. This motion is going to be okay called abduction. Now this movement itself is going to be okay, because it's okay a movement of your shoulder joint. Okay, so one of the actions of this big muscle that you have on the outside of your what the hell you call it? Okay, shoulder. One of the actions is going to be abduction of the limb. Or we can say okay, that will be one of the movements of your shoulder joint. But practically that is what the word abduction would mean in medical science. In FBI language, CCI or CSI, special unit language, abduction mainly would just be as another word for as kidnap, right? Okay, what did they do in the case of as kidnapping somebody? Well, they take that person away. Did that make sense?
Yes.
Right, okay. Well, then somebody will say, can't we abduct the leg? Of course. It's okay if you take your leg and move it like this to the side or like this. Now, don't do both on the same time unless you are able to just jump at the same time. But you may see people who actually can stretch their legs out like this one, okay? But that stretching is mainly going to because they're able to abduct their hip joints. Did you guys get that?
Yep. Yep.
Good. So this motion here itself is going to be called abduction. Now we can use take another word and say ab. And the following word is not even in English. It's a medical term. It's just going to be normal. But if you look at it, the word normal means just going to be pertaining to the norm. Where you say it's abnormal is going to be away from being normal. In this case, as you can say, it's going to be not normal, right? But if you say that as everybody in this group here, or everybody is who is placed in this cycle here are considered to be normal. What they mainly will say, whosoever is abnormal, who doesn't fit these criteria, most likely going to be kept outside the group or kept away. Okay. Any questions?
Nope.
Good. Now, guys, the next one is going to be just the opposite of ab, which is going to be ad. Now, if ab meant away from, ad is going to mean, because it's towards or close by. Or near or approaching. Now, guys, if I, for instance, was standing like this, let's say it's with my arms abducted. But yes, if I bring them back down like this, that is going to be what we call adduction. Is that clear?
Yes.
Right. Okay. Likewise, as if I had as you can see, my limbs stretch out like this. That's if I break them back to, we can say it's normal. That will be adduction. So adduction and abduction are mainly as two motions which are complete opposite to one another. A cheat, guys, and yes, I used that cheat some 30 years ago. And cheats still work. Just think of the word add. And when you add things, what is that you're doing? Putting it together, right? Okay, that's how I remembered it back then. So because which of them was abduction, which of them were adduction. That's like, okay, when you learn the ABCs, that's okay, many children may have a different difficulty, and it's okay, distinguishing between B and D. Okay, so any questions?
No.
Good. Now, guys, it's okay, a word ana. Mainly, it's okay, we mean apart. Or in some cases, it's okay, up. Now, two terms. One term is going to be as okay, what we call anatomy. Now, guys, when we look at the word, or it's okay, the term anatomy. Now, ana was mean as okay, apart. And chomi is okay, was cutting in two. So pretty much okay as the way that subject anatomy got its name was based upon us, okay, how it was studied, because it's okay, how was it that they studied anatomy? It's okay, they cut into the body. And next thing is okay, take it apart. Or cut it apart. And as they go deeper and deeper, yes, okay, they mean yes, okay, separate structures and look at them. But if you look at the word, it's okay, the term anatomy also means it's okay, just made out of ana and then chomi. Which means it's okay, just meant cutting it apart. Okay. So the term means one thing, the word actually, that the word anatomy now means the study of the body structures. Did you guys get that?
Yes.
Good. Then there's going to be a okay, another word. And we can say, okay, the term may mean one thing and the word may mean another thing. Or you can say, okay, analysis. Now, I hope all of you that's okay will be agreeing on that, okay, as since it ends with cis, this becomes just okay, a procedure. Where okay, the lie or lies here is okay. Actually, it's okay, was derived from lies, which means breakdown. So what mean is okay, what you mean is okay, do when you is okay, do what you can call analysis. Is okay as you have an issue. Okay. Now you really want to just okay study this issue here in detail. But the first thing they will do is okay, they'll say, okay, let's just break it into pieces. And what they then do is okay, as they take those pieces and pull them apart. So now it's okay, you have different parts of your issue. And okay, what they mean is okay, they do then is okay, it's okay, let's look at each component here. Okay. But after that, yes, okay, when you need to, yes, okay, conclude, yes, okay, you mean, yes, okay, just put the pieces together. Or you can mean says, okay, the whole process of, okay, in which, okay, analysis is going to be done. We're not going to check the thing as a whole, but look at it in individual parts. Did that make sense?
Yes.
Yes.
Okay.
Yeah.
So you guys may have seen, yes, okay, those TV shows where they have, okay, yes, you can say, okay, want to solve a mystery, a mysterious crime that has been committed. They have some suspects, and then they okay, but they mean it's okay following each of those suspects and say, okay, well, what is the link between them? So once that is established, okay, mystery solved. Now we have enough proof to prove that okay, these were the bad guys or whatever. Okay, but the mainly is okay was study each of these persons separately, individually. Okay. So what you do at the end of your analysis, you mainly is okay, just connect the dots. Okay, but first you have to make your dots. Okay, and by making the dots, that's mainly as okay what they call the analysis. That you break it up and pull it apart. Have any of you ever been playing with okay building blocks or Legos?
Yep.
Okay, you have built something, okay, but um, okay, but if you want, yes, okay, so okay, let me just see, yes, okay, which shape of blocks I used. How are they put together to build this object here that I made? Well, okay, as to do that, that will be as okay analysis. You have to break it apart first. That's okay. Well, here are my pieces. Okay, now. Okay. Now, a common kind of analysis is what you can call it, okay, urine analysis. Okay. Now, that's okay. Essentially, just okay, use. Oh, so let me use a more, yes, okay, urine color. Okay. So the actual word was, that's okay, urine. And we can say it's okay, analysis. Right, okay. Where you mainly say, well, okay, now what's the urine analysis? Well, okay, guys, it's okay. You have a sample of urine. In this urine here, that's going to be as okay, different materials. Because there's okay, there may be some sugars, there may be some, let's say it's okay, some blood, there may be some proteins, there may be it's okay, some other substances. Clear? Okay. But urine analysis is mainly going to see, says, okay, what was it that we had in the urine? Okay, yes, we had blood. We said, okay, yes, we had some proteins. We had some, let's say, okay, some white blood cells, and so and so. So maybe it's okay looking at each of the different components of the urine separately. Not physically breaking it up, but it's okay breaking it up for study purposes. Right, okay, and then you can say, okay, we have blood in it. Okay, is this at a dangerous level, or is it normal, or is it something that, okay, maybe needs to follow up upon or something? Things like that, okay. What's the level of proteins and what's the level of sugars and things like that, okay? So when you get, okay, yes, urine analysis, that's going to be okay report. Okay. Some of these is going to okay be done by okay those test strips. Something is mainly okay just by looking at the urine. This is going to be things such as okay as what was the color like, for instance. Okay, was it clear? Was it? It may sound crazy as okay. Was it cloudy? Something like that. Okay. Um, did it have okay as a very characteristic smell? Okay, and okay, this guy says okay for your satisfaction. Well, okay, we don't taste urine anymore. Okay, unless you are Keisha. Oh, okay. Now, guys, this I read it once. I don't know why I ended up okay Google searching for that. I thought I was trying to find okay as a funny video about accidentally as okay drinking a urine sample. But anyways, okay. But 90% plus of your urine is nothing but the water that you drink. So if you filter it, well, okay, yes, you may end up with clear, drinkable water. But she said, okay, yes, it was good for her skin. So, okay, that's fine. Good. Okay, guys, any questions about NT? Any questions about NT?
The ANTE?
Yes.
No.
Good. Any questions about anti?
No. No.
Okay, now we can just take one. I don't think that we have talked about that. We can say it's okay, anti, which means it's okay, just means against, or even if it's okay, work against, right? We can say it's okay. Where it's okay is pertaining to inflammate. As means it's okay, we can say it's okay, just inflammation. What I mainly as okay told you guys is okay, yes, inflammation is mainly as okay your body's first response to any trauma. Or even yes, okay, any yes, okay, because it's okay. unknown, unfamiliar substance that's okay entering the body. Your body's first response is going to be an inflammation. Okay. Now, good is good, but then too much good is bad. Okay, so that's what's okay. That's why the mean is okay may use, or we can say okay anti-inflammatory drugs. Okay, Motrin or ibuprofen, as you may call it, is a common example for that. Advil, okay, Aleve, sorry, or naproxen is okay as another anti-inflammatory. And some people may yes, okay, even categorize as okay your Tylenol as okay as an anti-inflammatory drug. Okay. Now, as far as okay, as anti-inflammatory, or we can say okay, substances or drugs that mainly as okay are two major types. At least okay, which has been used for it says okay ages and ages and ages and ages. One is going to be as okay what we call as okay the non or NS AIDS. And all as I said is okay earlier as okay or being drugs such as Motrin, for instance. Okay, you can say it's okay. Aleve, it's okay. Diclofenac sodium. They are all it's okay non-steroidal anti-inflammatory drugs. Where it's okay, the N stands for non. The S stands for it's okay. Steroidal. The E mainly is okay, just stands for anti. And I is okay as the inflammatory. And okay, let me guess this. Okay, the D is the drugs. Now, why would you call these as okay non-steroidal? Because okay, they are not steroids, but they still as okay works as or against your inflammation. And that mainly as okay just brings us okay as to the other category of yes okay inflammatory drugs, which will be steroids. Things such as cortisone, for instance. Right, it's a steroid, and okay, what it also is going to is okay, be a type of steroid that's okay works against inflammation. We can use as okay things such as okay as prednisone. They are steroids and they as okay are anti-inflammatory. So that's why the meaning says okay that we had this other category of anti-inflammatory drugs which were not steroidal or known as non-steroidal anti-inflammatory drugs. Okay, guys. Now, guys, okay, yes, is there anybody who is in the least doubt about antigen versus antibody? Yes, guys.
Sorry, I was finishing writing. You're asking if we had any doubt versus the two of them?
Yes,
I don't personally. I don't.
you don't. Okay.
Mm-mm.
So should I assume that you guys are clear on those?
Yeah, I'm good. Thank you.
Good. Okay. That just brings us on to our next term, which is by. Wait, I say yes. Okay. Now, the verb by can mean two, and it can also, yes, okay, mean both. Okay. Now, guys, okay, yes, there will be another word that means the same as by, which is die. Oh, that's okay. The word die. Well, okay, not going to mean both, but maybe that's okay. Just chew. Now, yes, okay. The other day, when we were talking lateral, we say it's okay, bilateral. But again, it's okay. The word here, it's okay. Mean, it's okay. Was, it's okay. Pertaining to, and lateral was sites. Now, okay, here we can say it's okay that the by mean is okay or mean both sides. So on both sides or bilateral. Okay. Then maybe okay. Okay, you can say that we can say okay, what should we buy? And okay, the reason I talk about this one here is mainly because okay, yes. Like this. Yes, okay, the verb buy mean, yes, okay, or mean. Chew. The L is again, yes, okay, pertaining to. And now, guys, the word lingua. It actually is okay, will be lingua. Is tongue. Is that clear?
Yes.
Yes.
Now, yes, okay, if you look at this word, you may say it's okay, pertaining to having two tongues. No. Now, guys, have you ever wondered, yes, okay, where in the blue is it that, okay, yes, the word language came from? It was derived from lingua. And then yes, okay, if somebody asks you, yes, okay, what is your mother language? That can also be referred to, or that could be the same as saying, yes, okay, if somebody asks you, yes, okay, what is your mother's tongue? And you will say, yes, okay, well, my mother's tongue is in my mother's mouth. Hopefully. Okay. Okay. But that's what it means. What is your mother's tongue? Now, some people who may be biracial, and you can take any crazy combination. But what is going to be your mother's tongue?
Whatever her native language is.
Okay. If you want to put it that way, okay. But your mom is Irish and your father is from Japan. So let's just assume. Now my question is, okay, is your mother language going to be Irish or English, or is going to be Japanese? Anybody's father is from Japan and mother from Ireland, what is going to be his mother language or her mother language or mother tongue? No idea? Guys, there's only two options. It's A or B. You're not going to get killed if you guess wrong.
Isn't it going to be
English.
whatever they know most of?
Huh?
Whatever they know most of, whatever they speak on a normal basis.
Okay, they may say, oh, I guess speak neither of the languages. It will be the language of your father. Okay, guys. Now let's say yes, okay, your mother and father were from two different countries. They met somewhere, you were born there. That country doesn't have, yes, okay, what you call it, okay, citizenship by birth. That is because you happen to be born in that country, yes, okay, you automatically become a citizen. Now my question is, okay, yes, your father was from Japan, your mother was from Ireland. Are you Irish or are you Japanese? Just because you happen to be born in Australia. As you can see, Australia doesn't have a law that yes, okay, grants you citizenship just because you were born in the country. You will be Japanese. So it goes off the father.
Why?
I can just tell you, yes, okay, how, but not necessarily why. Okay. You may say, well, okay, I don't speak a word of Japanese. I never been to Japan whatsoever because I've been living with my mom. But yes, okay. So So it's okay. Legally, it's okay. On the paper, it's okay. You are. That's just weird. Okay, guys. But, just okay. The word lingua or language actually is okay. Is derived from the word lingua, which actually is okay. Meant or meant tongue. So it's okay. Being bilingual is mainly it's okay. You can say it's okay. Just speaking two languages. Now, guys, okay, as there will be, as okay, there is another word that mean the same as tongue, or more of okay as a structural term, and that's going to be glossal. Maybe meaning and against says okay, the word or the thing here is meaning it's okay, that's going to be as okay you are pertaining to. And gloss, GLOS, is the same as tongue. Now, since we already as okay are on lingual, let's just take another word as okay that, and that will be as okay what we can call it as okay. Sublingual. Okay. Where we know that okay, yes, the word sub means under. Yes, okay. Al is mean yes, okay, or furious, okay, pertaining to. And lingua is tongue. Right. So sublingual, that's me, it's okay, going to be under the tongue. It's a common, it's okay, we can say it's okay. Route of administration of drugs. Some people, yes, okay, maybe ask, especially that's okay for people with okay as angina, as we may call it. Okay. Okay, if they start experiences, okay, that's pain. They may be asked, yes, okay, take those 2 small pills like that and put them underneath their tongue. So that's going to be, yes, okay, taking them sublingually. Did you guys get that? Okay, and some may, as okay, ask why do they need to take it underneath their tongues? First of all, it's okay, that drug, if you swallow it and it goes to your stomach, it's going to get destroyed. Okay, the environment of the stomach is actually is okay going to pretty much completely destroy that drug. Likewise, guys, okay, as a medication that you swallow first has to go through your stomach, be broken down in the stomach, being released from the stomach into the small intestine, after which it can be absorbed. That can easily take an hour to an hour and a half for that to happen. And by that time, it's okay, you might have been, or it's okay, died from your heart attack. Right, okay. So some of you will say, well, okay, why not just stop the drug up here? That's okay, let it go as okay, transdermal. Mainly because, okay, the blood supply in the floor of your mouth comes directly from the heart. So that's why they say it's okay, what is on your heart, at some point is going to say it's okay, come out from through your tongue. So that barrier, that's mainly as okay, just for okay as detectives want to break. Okay, so but the main says okay, that's the main have found out that okay, as it reaches to the heart within okay as matter of seconds. And may relieve the patient from his chest pain. That's okay. Sublingual, yes, okay, underneath the tongue. The word glossal is, well, okay, maybe yes, okay, the mean yes, okay, just use it for, yes, okay. It's like pertaining to, yes, okay, nerves and so and so. To the tongue and okay, as to structures below the tongue. Any questions?
No.
Good. Should we talk Brad Pitt? We can say it's okay, Brad or Brady. May just means slow. Always okay. When we say slow, we can mean it's okay and use Brady. We can mean it's okay. Say how slow? Well, practically it's okay, slower than normal. Now, mainly it's okay. Just three Bradys that I will talk about. One is going to be it's okay. Sorry, Brady, card, yeah. Yeah, it's okay, me because okay, it's like a condition, not really a condition, but mainly it's okay. Hard is your heart. And here it's okay, the word Brady means yes, okay, just means slower than normal. Clear? But technically it's okay, so we can say what does the word bradycardia mean? Just okay, that means okay, just mean slow beating heart. Okay. But the question is, okay, what is normal for the heart to beat? Well, okay, as the lowest normal of the heart is 60 beats per minute. So if the heart beats less than 60 beats per minute, that will be referred to as bradycardia. Okay, so if your heart beats at less than 60 beats per minute, which mean roughly as okay 1 beat per second, that will mainly mean that okay the person has bradycardia. Did you guys get that?
Yes.
Yes.
Good. What else can be slow?
Breathing.
Who said that?
Caitlin.
Good, yeah. Bratty. Now what are we going to use for breathing?
Pina, like P-N-E.
Okay, exactly. So it's going to be bragnia. Okay, all the yes, okay, again, yes, okay. We write the P, but it is silent. So yes, okay, it still comes in the writing, but yes, okay, in this case, yes, okay, it's going to be silent. Okay, so bragnia. Now, usually it's okay, what they say is okay, the normal breathing is okay, the lowest is going to be okay, 16 breaths per minute. So it's okay, we say it's okay, less than now, okay. Otherwise, someone goes, okay, I don't breathe 166 times a minute. Okay, 16 breaths per minute. So it's okay, less than 60 breaths per minute is going to be called bragnia. Is that clear? Last breath. It means it's okay, just for me, it's okay, slow. And the word that we will be using here is going to be kindness. And we can say it's okay, which means okay, just because it's okay pertaining to. And yes, okay, it means it's okay, the word kind. Which is going to be as okay, we can say it's okay, emotion or movement. So slow movement is going to be as okay, what we can call bradykinesia. Okay. Now later on, we may come across as okay, sorry, the term called kinetic. Sorry. Again, it's okay, we can say it's okay, the ick is pertaining to and the kind is motion. Right, okay. So the word kind mainly is okay just for me, motion or movement. So it's okay. Bradykinesia is going to be as okay, slow motion. Or we can say it's okay, slow body movements. In some instances, okay, they may even refer to as okay, slow initiation of a movement. Because the movement may be as okay, normal itself, or be as okay at a proper speed. But just the initiation of that motion or movement of the body is going to be slow. Okay, so that can also as okay be referred to as a slow movement. Any questions?
No.
Okay, guys. This. Okay, that I mean bad, painful, difficulty. Or as you said, it's okay earlier, it's okay abnormal. Now, if you go and say it's okay near, okay, where here is okay, your P is silent, which just means okay, difficulty of breathing. Right, okay. We can say agia, which just becomes yes, okay, difficulty in swallowing. We can say urea. Now, when we say dysuria, in most instances, guys, is mainly going to be as okay, pain while peeing. Okay. Yeah. Okay. Mainly as okay, a common symptom for yes, okay, what we call yes, okay, a UTI. Is going to be as okay that the patient has experiences okay a lot of pain as he or she is peeing. Most likely, it's okay that pain is just okay during it's a burning pain. Okay. But generally speaking, as okay, this urea will be as okay difficulty or as not sorry painful or experiences okay pain while peeing. Now, just as we had earlier, it's okay. We said this kinesia, which mainly means it's okay abnormal or it's okay bad movement or motion. A is okay because not here is okay. E is still is okay, just pertaining to or a condition. Okay, you say okay, pertaining to so that would be as okay, come kinesic or kinetic. Okay. Okay, where the word kind mainly is okay was for motion or movement. But here's okay, not slow, but rather bad motion or it's okay, abnormal body movements, if you want to put it that way. Okay. And what's bad about or what's abnormal about that probably is okay, may need. Okay, so this is like a further elaboration or explanation. Now, There's another one. Now when we say it's okay, dysmenorrhea or dysmenorrhea, that's again it's okay. Now it's okay. The menorrhea is going to be it's okay for your menstrual flow. Or mainly it's okay experiencing pain. Or because dysmenorrhea mainly is going to be it's okay what we can call it's okay experiencing pain and it's okay during the menstrual cycle. Okay, so painful menstruation, that's okay. It can also be referred to as dysmenorrhea. We can say it's okay, this. Plasia. Now, E here is again, it's okay, going to mean that okay, as this here will be, it's okay, it says okay, the whole thing is okay, will be a condition. Okay, where plus. Here mainly is going to be, that's okay, because it's okay, related to, it's okay, because it's okay, formation of, sorry, tissues. What the hell? Sorry. So that is abnormal. That will be as okay referred to as dysplasia. If we had no formation of tissues, that would have been okay, aplasia. And we know that the word a means what we just meant. No. Okay, guys, there's going to be one last one, and that will be that we can talk about. And it means okay. In this case, that's okay. It will be primarily okay due to pain. Oh, that's okay. Experiencing pain, that's okay during a sexual act now. More common, yes, okay, in females, contra to men. And okay, one of the common reasons for it is what they call as okay, a PID. Which mainly is okay, what we call is okay, pelvic inflammatory. Now, some people will say it's okay, disease. Some people will say it's okay, disorder. Okay. But guys, have any of you ever wondered, for instance, okay, when you say disease, or even as okay, if you say disorder, Although it's okay in English, we spell it D-I-S, D-I-S. Or where did the D-I-S come from?
DYS.
The D-Y-S. Or the D-Y-S. So yes, okay, when you say disorder, it means yes, okay, there's going to be yes, okay, something which is in bad order. And if things are in a bad order, you can say it's okay, they are disorder or yes, okay. Have you thought of okay as what the word disease actually means? What does the word ease mean? Right now, are you guys at ease or not?
Does that mean like calm? Like relaxed?
Relaxed is more okay. So that's where the word disease come from. Yes, okay. They say, well, okay, probably not at ease. Right, okay. So anything that causes you not to be at ease could be a disease. Or you can say, okay, something that causes you or makes you not at ease would be, yes, okay, a disease. Okay,
That's you.
thank you, Dan. That's due to disease. No, okay, hopefully not. Okay. So, and likewise, you can say it's okay, dysfunctional. If your remote is not working the way it should, remote control, that would be dysfunctional. Or any piece of mechanism or mechanics doesn't work the way that it should, that would be dysfunctional, right? Because you can say it's okay, it's not properly functioning. Okay, guys. Now, just take a short break. Should we say for 10 minutes? And I see you guys back at 40. 10:40. Okay, guys. Have fun till then. Now, guys, EC, if you see it, mainly it's okay, is just coming from the word X. Both of these will mean out, or we can say it's okay, outside. Okay. Now, guys, since you guys are yes, okay, DMS, and at some point, go for you as okay for your OBGYN scans and so on. So you may come across what they call as okay and ectopic. Now it's okay where the word ec is mainly as okay going to be as okay because it's okay outside. Ick is as okay as our favorite pertaining to. And top, no, not really as okay location, as okay on top of something. For me, it's okay because it's okay. Just refer to as okay. Location, location, location. Now, something which may be referred to as being ectopic, for instance, as okay, as we may say, it's okay, an ectopic. Pregnancy is going to be a pregnancy that develops anywhere outside the normal area for a pregnancy to develop. Now, the normal area for a pregnancy to develop will be in the uterus. Okay, a pregnancy that develops anywhere outside the uterus will be referred to as okay as an ectopic pregnancy. Now it can develop in the tubes, the fallopian tubes. Okay, that is not going to be able to survive. In worst case scenarios, okay, it may as okay, even as okay, develop in the pelvis. Not even inside the tube, not to talk about as okay, inside the uterus. Okay, so they both yes okay can be yes okay examples of yes okay an ectopic pregnancy. So you can maybe say okay, the word ectopic is used for anything that is not found in its real position or real spot. Did that make sense?
Yes.
Now, guys, the opposite of ec opposite would be yes okay. N, which mainly is okay, or we can say it's okay. And with N, yes okay, comes endo, for instance. Which means yes okay will just mean, sorry. One way of saying yes okay, inside.
Sorry to interrupt. What does it say in pink? Is that
This
low?
location,
Yeah. Location. Okay, thank you.
no problem there. Or if on this instance, yes, okay, especially it's okay, we talk about something being ectopic. Because it's okay, outside is okay, the proper location. Well, that's going to be the proper location for a pregnancy, the uterus. Okay, but anywhere outside that proper location is going to be referred to as a ectopic pregnancy. Now the word endo mainly yes okay will mean yes okay either in, inner, or inside, or within. Now if you go into yes okay into the microscopy of tissues and things like that, actually it's okay. will be something that may, yes, okay, be referred to as endothelium. Whereas, okay, the endo mainly is also going to be, yes, okay, what you have on the inside. Thelium here is okay, mainly is okay, the same as, okay, as type of cells that you have in epithelium, but mainly is okay, just found on the inside of your body structures. So that's why it says, okay, epithelial tissue is found on the outside of body structure or body surface. And okay, it's in the lining of your body tissues. But where it actually is okay, can be referred to as endothelium. Now we can also say as okay, endoscopy. Colposcopy, whichever. And those of you who still do not know, yes, okay, the difference between colposcopy, please speak up now. Good. Mainly because that's okay, or B is okay. The tool to visualize. That's what we call it, okay, a scope. Visualize what? What is on the inside. Now, guy, usually it's okay. Now, that could be any scope. Usually it's okay, visualize any inside, it's okay. Or the inside of any body structure. But nowadays, usually it's okay when we say endoscope, or we can say endoscopy. It's mainly as okay, primarily as okay, used for a gastroscope or gastroscopy. Well, okay. Or you can go, yes, okay, rhinoscope, for instance. Now, what's a rhinoscope?
Examines the nose. It's a tool that examines the nose.
Exactly. If you watch botched, you will see it's okay. Them, yes, okay, using a rhinoscope. It's a little thing that they hold in the fingers. That they may, is okay, just put on in the nose. And when the release is going to, it's okay, mean that's okay, just going to, it's okay. You can just okay, push onto the nostrils and expand it so they'll be able to just okay, look up in the nose to see us, okay, what's going on. Okay, but it's a little less okay, handheld. Yes, okay, metallic instrument. You can go as okay, cranioscope, you can go gastroscope, you can go as okay, and laryngoscope, etc. Did you guys get that?
Yes.
Now we can say it's okay, epi. You guys will realize we have already okay talked about most of these. Where okay, the word epi actually is okay. That could mean it's okay, either about or it's okay upon. And okay, that's in some instances okay. It may be as okay. surrounding, all that's okay. The actually, that's okay. Correct word for surrounding was Perry, P-E-R-Y, P-E-R-I, sorry. So we had something that we call, yes, okay, the epidermis. And we can say, okay, if this is dermis, then okay, yes, the layer on top of the dermis or above the dermis is going to be, yes, okay, the epidermis. Now, guys, the other day, then we talked, yes, okay, layers of meninges, I said. Epidural. And that's going to be, yes, okay, or favor pertaining to the dura, actually, yes, okay, is from dura, which was, okay, yes, your dura mater, which was, okay, the outer layer of your, what you want to call it, meninges. Now, some people, yes, okay, may go and says, okay, epidural, mean, yes, okay, because that sounds short, or what they say, okay, what you actually will get in an epidural. It means, okay, call it an epidural because it's okay, they mean, yes, okay, administer the drug outside. It's actually, it's okay, outside the dura. Okay. And okay, that's what this drug means. Yes, okay, just do is okay, so it will pass through the dura, it will pass through the arachnoid, it will pass through the what you want to call that, pia mater, and okay, let's get to the spinal cord. And then okay, yes, it will work. And most likely, yes, okay, what people will experience, okay, yes, I don't feel anything below this level here. Or we can say, okay, don't feel, yes, okay, anything in the area supplied by these, yes, okay, nerves here, which is below the point where the epidural was given. But we can also, yes, okay, say, yes, okay, what if we have what we call, yes, okay, an epidural? Now, it can be, yes, okay, hematoma. Where you mean, yes, okay, we just say, okay, yes, that's what means, yes, okay, just a mass of blood, a collection of blood, right? Okay. Outside the dura. Now that can happen in case of, okay, yes, a fractured skull. But the reason that, okay, yes, or okay, that there's no hemorrhage, that you see as, okay, the patient bleeding is because, okay, the skin did not rupture. The bone fractured, and okay, as might actually, as okay, cause the bone to bleed. But since the skin was intact, the blood can only, as okay, collect in the epidural space. Okay. And okay, if that hematoma is okay, gets big enough, it actually is okay, may start as okay, putting pressure up against the brain, and the patient may become more and more and more, yes, okay, what do you want to call it, it's okay, affected by that. So that's one of the great risks for people with what you call fault tendencies. And unfortunately, most elderly people. Poor balance, things like that. And they may not be as well alert, oriented, even before that fall. So unfortunately, in many cases, this may just be, well, you can say it's ignored in the sense, he's elderly, that's how he has been. And actually it's don't realize that, he is getting worse. Okay. And they say, we don't see anything. Well, the skin is still there. I was like, yeah, but just because the skin is intact doesn't mean that he couldn't had fractured the bone. Okay. Any questions?
Nope.
Okay. And then we yesterday, I think we talked of epidemic work. Epidemic versus pandemic. And it was says that he is the word epi actually is was be mean is referring to is to the nearby surroundings. Okay, guys, let's take X. And as this says, S is out. In medical terms, yes, you may come across the word extra, which means yes, then just would be yes, outside. Outside what? Well, probably yes, the term that's going to come after extra. Clear? And in some cases, this X here actually that's can be replaced by the word ek. That's that we find is sign ek to me. Where ek was out, and we see that to me, for instance, was cutting out. We can say cutting into, but mainly that's when we say cutting into, or actually mainly will be yes, cutting out. Okay. Where this to me, yes, we use X can be scission. But the word scission mainly is just means the same as cutting. Where you say it's excision as going to be cutting out. Did you guys get that?
Yes.
Yes.
Okay. So you can say it's cutting out of any mass, etc., etc. Now I may use this word here, guys. Just to make your life easy, I will say yes, okay, this here will mean out. And what is the traction going to mean? Have any of you heard of something being extracted?
Yeah, so it'd be like to remove.
Okay, so it's excision. But what's the difference between excision and extraction? In excision, you cut something out, right? Or remove. So do you do in extraction. So what is going to be the meaning of it? It's okay, extraction. As when was the last time you visited a dentist? Okay. I guess it's about time then. Now, what is it that a dentist do? Be honest. Why
Sometimes
do you? Permit it?
I was just gonna say sometimes they extract teeth,
Okay.
they remove them.
Okay. But how?
They rip them. They
You
cut.
can say, okay, but long live Home Depot. Right, okay.
They use
So
a
they
drill.
may
Do they use
permit
a
it?
drill? Kind of.
Okay, my dear, if they're using a drill, what they mainly is okay want to, or what they are trying to do is avoid extracting your tooth because they're going to fill up that cavity, right? But yes, okay, if they extract your tooth, what would be another word of saying that? If I say yes, okay, it's going to be forbidden to use the word extracting a tooth. So how would you say then? You guys are LOST? Don't they call it pulling? That's why I say it's okay, long live Home Depot. They mainly it's okay, probably it's okay. Pull the tooth out. Like, okay, as if you have a nail in your wall or in a piece of wood or something, you say, okay, I need just, okay, get this removed. What will you get? Something that look like the tool that the dentist use, and you may, it's okay, grab it and pull that nail or screw out, right? So what does the word tract means now? I
Pull
just
out.
said it. Pull. And the X is out. So pulling out. Have any of you heard the word tractor? No, okay, some of you may say, yes, okay, I only heard of a tractor. I don't know what it does because I've never been in the country.
You don't have to be in the country. I mowed my lawn yesterday with my tractor.
Oh, okay. But okay, that's okay. Yes, your lawnmower, right?
It's a ride-on tractor is what it's
Okay.
called. Yeah.
But as you can say, it's okay. Your lawnmower is okay, or tractor pulls the lawnmower for you, right? All right. But it's okay if you go to the country. It's okay. Back in the day, they used to use cattles to pace that plow, and okay, they mean it's okay. Just walk the. It would be just okay, a bull or something like that. I mean, it's okay. Just would pull the plow, and that's how they'll plow the fields. Now they have tractors to do that. So what does the tractor do? Just pull the plow. Okay, guys, how would you guys define a dentist? Let's see what your imagination is. I say something for God's sake.
You're saying how would
You go. So you
are you saying how would we define a dentist?
Yes.
A specialist of the mouth? Isn't dent mouth?
No. Dentist teeth.
Dentist, specialist of teeth.
Okay, yes. Okay, a tooth specialist. Okay, a person who is specialized in that's okay, diseases of the teeth, and okay, not even say the gums, right? Okay. That's okay as you can say it's okay as sort of official definition. But yes, okay. At one place I read the definition that says yes, okay, the person that pulls your tooth out of your mouth and the money out of your pocket. Have you ever been to a dentist and he pulls the tooth out of your mouth and say, well, here's a bill for us, okay, that's okay, that's $1,200. And you say, I could have asked the tooth fairy to do that for me for $10. Right? Okay, that's okay. Just okay, some crazy. Okay, so yes, okay, guys, extraction is pulling out. Okay, whereas excision is cutting out. Okay. And that's okay, yes, that's like again, yes, okay, I say okay, yes, extra. Extra more is okay of a positional term, which means okay, well, that's again mean yes, okay. Outside. Okay. Outside what? Mainly is okay, what comes here. Okay, guys. We can check the next one. Hemi or hemi. And I think we even talked about this one here yesterday, which meant half. Okay. We see it's okay, colostomy or colonectomy. a colon or call, yes, okay. In some cases, they may just use, the word call. In some cases, they may just, use the word colon. So both is going to be, correct. Okay, which means, it will be colon or, the large intestine. And here is, we can say, the act was mean as, just out. And show me was cutting. But when we say, ectomy as a whole, is mean is, or just, mean removal of half of the colon. Okay, now not necessarily it's half, but even it's if there's rumors, part of the colon that will be called a hemicolonectomy. Now, guys, another word, and it's going to be as hemi. And the next word we have is going to be as plagia. It means that's since it ends with ia, that becomes just a condition. Okay. Yeah, pledge or plague or plagia. Mainly it's just a fancy word for what we can call is paralysis. Okay. And when we say it's hemiplegia is mainly going to be as paralysis of one half of the body. So you may have a person like this. Now he or she is maybe let's say is paralyzed. On this side of the body. You can mean that's half of his body is paralyzed. So that would be as hemiplegia. Okay. Now, guy, not the funny thing, but yes, the interesting thing is that yes, he may be as let's say he's facing us. So right now, yes, he is paralyzed on the right side of the body. Primary is due to yes, a lesion in the left side of the brain. Did that make sense?
Yes.
Yeah.
Okay. So it's actually that's the left side of your brain that controls the right side of the body, and the right side of the brain that controls the left side of the body. So if somebody has had a hemoparalysis or hemiplegia of the left side of the blood, also going to be because he or she would have a lesion in the right side. But then some of you may ask, okay, Mike, what happens to the face? Now, in this case, yes, this guy may be, yes, paralyzed on the left side of the face. So, but that all has to do with, yes, where the nerves from the left side passes on to the right side. That will determine that. But usually it's okay, people with as paralysis on the left side of the body will be paralyzed on the right side of the face, and vice versa. Clear? People who are paralyzed on the right side, 90% plus of those people who also have as some sort of dysphagia or aphasia. Mainly because the region that as controls as things such as your body movements and so on. So on the left side of the brain, which controls the right side of the body, lies pretty close to what we call the Wagner's body and the Broca center, which are mainly as your two speech control centers. So they will get affected. And most people are what we call right hand dominated. The right side as their dominant side. So we can make says this opposite control of the brain by the control of the body by the opposite side of the brain is what we call ipsilateral. That is the right side of your brain, left side of your brain that controls your right side. And the right side of your brain that controls your left side. So that phenomena is known as ipsilateral, IPSI, and then lateral. Clear? And when Ami says, that's because nerves on the right side pass to the left, and nerves on the left side pass to the right. And that passing from right to left and left to right is what they call decussation of the nerves. So yes, different nerves, yes, will pass from right to left and left to right at different levels. And that means explain what I just talked about earlier. That person is being paralyzed on the right side of the body, but it's going to be the left side of the face that will be paralyzed, and vice versa. Now, how can I sit here and say that so surely? I can say it's I've seen a ton of patients who are paralyzed in one way or the other. So yes, a ton, that would be 1,000. At least 1 ton. At least 1,000, because most of our medical departments that we went to, a big chunk of the patients were patients with paralysis. Not at OKS, I even worked OKS for 2 years in OKS neurology and neurosurgery. So in that case, that's especially neurology, that's we had 90% of our cases were patients who were paralyzed in one way or the other. Okay. So plegia is mainly as just a fancy word for what you in English will call paralysis. Is that clear? Now, guys, hyper and hypo. Do you guys remember hyper?
Yep.
Greater than normal. And hypo? We can say it's okay. Lower than normal. Right, okay. In these, you made is okay, talked about is okay, different emias. Hypoglycemia, hyperglycemia, hyponatremia, hyperkalemia, hypokalemia, blah, blah, blah. Okay. But guys, okay, as with these hypers here, is okay, that means it's okay, two last things that I want you. And that's going to be as okay, we can say it's okay. Plasia versus trophy. Yeah, for instance, okay, when we say hyperplasia. Mainly as okay now. So it's okay, so it ends with E, that means it's okay, it just becomes it's okay, a state or condition. Or what happens in what you refer to as hyperplasia is going to be as okay, we can say it's okay, an increased, because okay, increase in the number of cells. And okay, what that hyperplasia mainly is okay, will lead to is okay, as the increased size of the tissue, that the tissue grows. Whereas likewise, okay, as when we say as okay, hypertrophy. Now what means is okay, it just happens as okay, and the trophy is that that's going to be as okay, an increase in the size of the cells. Where that as well, it's okay, also it's okay, will lead to it's okay, an increase in the size of the tissue. So the main difference between hyperplasia versus hypertrophia is that in hyperplasia is going to be as okay, the number of cells that is increased. As in hypertrophy, as okay, the number of cells stay the same, is that the cells that become bigger in size. Where, okay, guys, the opposite of trophia, or hyper, in these two instances here, can either be this and this, which means as okay, will just mean bad. Or which in this case, as okay, mean is okay, mean that okay, there will be as okay, a decrease in the number of the cells. That will be called okay, dysplasia. Okay, or we can say okay, decrease in the size of the cells, which becomes okay, dystrophy. Where we can even yes, okay, take it to yes, okay, the extreme, which becomes yes, okay, aplasia. Where we can say okay, now A means yes, okay, will not just mean decrease, but no. where you actually, it's okay, may say that you can actually lose the number of cells. Clear? Or atrophy, where the size of the cell actually is okay, gets completely lost. Did you guys get that?
Yes.
Okay. So that's okay. An example of cell that is okay, may is okay. You can say it's okay. Increase by is okay. Hypertrophy is your muscles. The number of the muscle cells does not increase. They just become bigger in size. Well, okay. On the opposite side, you can say, okay, one, okay, as your muscles become smaller. That would be an example of, okay, it's either dystrophy or, in worst case scenarios, okay, atrophy. Now, when we say it's okay, plasia and trophy, yes, okay, the pertaining to can be, yes, okay. Plasic and trophic. Now, please make sure that you know the difference between plasia and trophy. Did I make myself clear?
Yes.
Yeah. Just to check, so hypo and dis, I know they have like different meanings, but in
Mhm.
this case, they both mean like a decreased number of cells or a decrease.
No. Hyper would be is okay. Increase.
Right. No, I'm saying hypo and dis would both.
No. Okay, because okay, what I mean is okay, meant to mean here or say here was when you use plasia, the opposite of hyperplasia is not going to be hypoplasia. It's going to either be dysplasia or aplasia.
Okay.
Likewise, okay, when you say okay, hypertrophy, the opposite of hypertrophy is not going to be hypertrophy. It's going to either be dystrophy or atrophy.
Okay.
Clear?
Yep.
Okay.
Thank you.
But where you can make it okay, dystrophy or is okay, dysplasia is milder than atrophy and aplasia. Clear? Okay. So mainly for these, okay, we just use either A or this rather than hypo. For other things, that's okay when you say, okay, opposite of hyper is going to be hypo. Hypotension, hypokalemia, hypocalcemia, hydronatremia, hypolipidemia, whatever. Okay. We can take an example, for instance. We can say, Now let me do this one here. We can say it's okay, hypo. Which will mean okay, it's going to be it's okay, lower. Now I may go and say it's okay. Wall. Emic. Where we know that M is blood. And it's okay, intentionally it's okay, just put the ick. Because okay, that one is okay, pertaining to. Now wall here. The mean is okay, just shorten it because okay, it bears okay, it's from volume. Did that make sense? And when is it that we use volume, guys? It's going to be as okay a way of measuring, especially as okay when we talk about things which are either liquids or gases. They are not going to be as okay measured by their weight or by the volume. Did that make sense? So something like, okay, a gallon, that's a volume. Now you may say a hypovolemic, and I just will let's okay say. Give an example here. It's okay, somebody maybe is okay having hypovolemic anemia. If we know that okay, this here is going to be okay decreased. But what caused him or her to become anemic? Mainly because okay, as the volume of blood is decreased. Now he or she could be as okay be anemic. The reason for anemic or him or her being anemic is hypovolemic. Okay. Now most commonly it's okay because he or she is okay might have suffered as okay from a heavy hemorrhage. Where okay, as a lower amount of a great volume of blood was lost. That makes sense.
Yes.
Yes.
Okay. Any questions?
No.
Now, guys, we also then can say yes, okay. In is mainly as okay what it means in English. In. Now we for instance okay said incision. And we know that okay the word in is okay. Incision just like okay as another word of cutting. So what is an incision? That first cut. That's what they call the incision. Now when we say in, and it's okay, this in mean it's okay, just primarily it's okay, just meant in. Or if you follow it with her. Now this whole term here is okay will become, or we'll refer to as in between. Or just between. Because the word between means it's okay, just will be it's okay. The same as in between. Whereas okay, yes, and I said probably as okay, I already have said this before that okay, yes, there's another word that we say it's okay in. We just for it's okay, where the in still yes okay means in, but then we go intra. Where this whole word here is okay word mean inside. Now guys, is there anybody who can tell me the difference between when to use between versus among? What's the rule? When do you use the word between and when do you use the word among or amongst? It's okay to say if you are never told that.
Like between two objects, I'm not sure what among would be, but
Yes, Caitlin, you are on the right track.
take it.
Guys, when you use the word between, you're talking of just two. That's okay, yes. You can choose between these two fingers. I can't say you can choose between these three fingers here. Or four or five. When it's more than two, it's going to be among.
Oh,
So between is only for two. And for outsiders, there's always going to be, it's okay, a cheat or clue or cheat. Now, guys, when we get to the heart, all we can say is okay, even it's okay when we talked about it's okay, our spine. We say it's okay, we have vertebra. And pertaining to these vertebrae is going to be vertebral. But what do we have in between them? Was going to be intervertebral. And that object or substance that we had in between the vertebra was going to be a disc. So we call this, okay, the intervertebral disc. Why do we call it intervertebral disc? Because it's the disc which is in between the vertebrae. We likewise also say it's okay, intercostal. And here we can just see it's okay, space. Why did we call it intercostal? Space, because it was going to be the space in between two ribs. Did you guys get that?
Yes.
Whereas when we say intra, it's going to be inside. Now, guys, some of you may have heard of what they call this, okay, and IUD. That's going to be, it's okay, an intra. And why do they call it intravenous? Okay, because it's placed, well, in this case, it's going to be on the inside. The U is okay as uterine, which means okay, just have me as okay, pertaining to the uterus. And D here is just going to be okay, device. So the reason that it's called the IUD or intrauterine device because it's a device that actually is placed inside the uterus. Well, okay, now a device is not going to be a mechanic device. I mean, it's okay, just something that okay, looks like the shape of a T. And these are going to be open as okay, as okay. These two extended arms of the T are going to just okay block the openings of the fallopian tubes. Okay. But the reason that they call it the intrauterine is going to is okay that it's placed inside the uterus. On the other hand, yes, okay, we can go and we can say it's okay, intra. Which again is okay, here is okay, intra will end all these instead of okay, mean. Inside now we may say it's okay, intra. Venous. Inside the vein. Now, yes, okay, whenever you, for instance, okay, get what they call, yes, okay, an IV. Why do they call it an IV? Mainly because, okay, it's given inside your veins. Now, yes, okay, you have this big bag with, okay, as whatever. But it's okay, whatever comes out of that back vein is okay, it's going to go, it's okay, whatever comes out of that back vein is okay, it's going to go, it's okay, directly into your veins. So the mean is okay, attach that bag. It's okay, yeah, it's okay, a cannula or ventrum to your veins. So IV is okay, most likely it's going to be I/V. Some people may even go as okay, IV like this. Both is correct. Where B is okay, intravenous, which means okay means inside the veins. Did that make sense?
Yes.
Yes.
You can check another intra. Which says okay, it was me, is okay, the same, it's okay, inside. Maybe I'll go and say muscular. Of course, it's okay, the AR is okay, pertaining to. And we can say it's okay, the muscle is the muscles. So these are a little bit more as okay, more out of okay, as your injections is that's what you want to call it. Because what is it they do here? They actually is okay, inject the duct inside the muscle, not in between the muscles, but actually is okay into the muscle mass. The last one was COVID. Right, okay, those injections. That's why, okay, they may say, okay, your arm may be sore for a couple of days, right? But now your arm is actually is okay, just a muscle. Okay, but they may say, okay, you may have okay, as a sore shoulder or something. But say I was giving it's okay intramuscularly. The abbreviation for intramuscular is going to be IM. So you may see drugs or it's okay, injectable drugs, and on the vial it may say it's okay, IV or IM. That mainly tells you as okay the way that it can be given. Okay. So there are some drugs that you can't directly as okay inject into the veins. Did that make any any sense at all? Sorry.
Yeah.
Okay. So please make sure that you know the difference between inter and intra. And I hope all of you know it's okay when to use between and amongst. You can say it's okay, intracerebral. Intracerebral, what would that be?
Within the head? No, within the brain?
Within the brain, right? Okay. Or you can say it's okay, inside the brain. Okay. Okay, guys, now just take your lunch break, and when we come back, we will talk about yes, okay, some of our last terms. Okay, so should I say that I see you guys back at 12? 15.
Did you say 1215, like 1-5?
Okay, let's just, okay, sorry. 50, okay. Okay. So see you guys at 12:50. Okay, and not 150, because that will be on Tuesday though. Welcome back, guys. Anybody want to say anything?
Hello.
Hello. Okay. Goody. Let's get to our next term. Mal. And mal means bad. Now, guys, you may have heard me using yes, okay, a word. Malignant again and again and again and again. Okay. Since that's okay, well, the word mal here is okay, still means bad. Now the word ignorant mainly is okay, is because it's okay pertaining to ignition. Main is okay, say ignition, or main is okay, B is okay, a spark or fire. Okay. Now, guys, we mainly say that, okay, yes, that cancers are malignant. Mainly it's okay because they spread like fire. Or we can say it's okay, a wildfire. Okay. We will talk about, yes, okay, that spreading is okay in our next term. Or we can say it's okay, one of the reasons that, okay, yes, cancers are bad. Or we can call it, okay, malignant is because of their, yes, okay, tendency to spread. Is that clear?
Yes.
Yeah, okay, yes, now if you go on the opposite side of mal, we say, yes, okay, we had tumors which were ben. Ben mean, yes, okay, just meant good. And okay, and then we could say, yes, okay, benign. Okay. It's okay, it was yes, okay. Good fire. You can say it's okay. Just keep in mind, girls. A good servant is a bad master. Okay. So fire, what is that? That means it's okay to serve you. But if they become dominant, well, okay, it's going to become a bad master. Okay, if the fire takes control, then okay, it's going to be okay, burn out the whole world. Now, okay, guys, there's another word where we can say it's okay, mal. We can say something like okay, as malfunctioning. Right. So that again is okay be something that is not because it'll get properly operated. Okay, if your system or if your ultrasound system is not working properly, we'll say it's okay that it's actually is okay, malfunctioning. Okay, yes, the not properly is going to be as okay. Mal, bad. Right, okay. Now, guys, okay, it's a word. And we call it malware. Mal actually is okay. Primarily as okay meant bad. Mainly as okay was followed by this part. Area. It's okay, yeah. Just make this whole thing yes, okay, the name or sort of a condition. By yes, okay, word over as okay, term area. Main yes, okay, was what the chart caused this condition where okay, area here is going to yes, okay, mean here. So what we yes, okay, still yes, okay, we still call it malaria. But the concept that they had about it is okay, back in the times was there was due to yes, okay, bad air that caused people to get malaria, or what we now call malaria. Now we know that it's not going to just okay be too bad air, but actually it's okay due to something that we just okay call the malarial parasite. Okay. But then again, it's okay. The question is, why didn't they change it from yes, okay, malaria to something else? Why did they name the parasite? I can see it's okay, laseitis. Okay. So yes, okay. What we now know to yes, okay, be caused by yes, okay, a parasite that is just called a malarial parasite. Previously was thought to yes, okay, be yes, okay, due to bad air. Did you guys get that?
Yes.
Yes.
Woody, woody, woody. Now, yes, okay. One other question is okay. Or was it, well, why was it that, okay, as malignant tumors or cancers were bad? Okay. We call them bad mainly as okay because they have the tendency to spread. Spread where? Yes, okay, spread beyond the area or site or location where the whole story started. So the next term that we will talk about is going to be as okay, meta. Where the word meta actually as okay means beyond. And where we mean you can say it's okay. That okay to spread is going to be as okay stasis. Now stasis is going to be as okay the process of now here's okay the word stays or stats if you want to put that. Actually it's okay come from state or you can say it's okay station, which mean or mean the location. So go beyond the location of where the tumor first developed. So the process by which it's okay a tumor or a malignant tumor, which is going to be cancerous, may spread to other organs is going to be called metastasis. Where we can just take an example. Let's say that okay, as we had the lung. Let's say somebody is okay developed some sort of okay as lung cancer. Clear? Okay. Now this lung cancer is okay may spread or may as okay metastase as a result of okay the process called metastasis. To another organ. Let's say as okay. Let's say that okay as it spreads to the liver. Now the process by which it's going to be spreading is going to be called metastasis. Where okay now in the liver what we actually is okay will find is okay as a metastasis. Did that make sense? So this means okay just becomes just okay the noun of spreading beyond the area. Okay. Where is okay originally started. But by the process of metastasis. SIS. Did you guys get that?
Yeah.
Yes.
Okay. So they may say, well, okay, the whole story started at the liver, not at the lungs. But it's okay, now we actually see that, okay, the tumor is found beyond the lung. We see it in the liver. We may even, okay, start seeing it in, let's say, it's okay, the bones. Okay. Before you know, it's okay, it may also, it's okay, be seen in the gut. Intestine or so. Okay, it may, yes, okay, even go to, yes, okay, to the brain. So that's just okay, what you will call, yes, okay, metastasis. Did you guys get that?
Yep.
Yes.
Good. Now we can take, yes, okay, another, yes, okay, two other examples of, okay, yes, meta. One is given in your book, and that's going to, yes, okay, be what you can call, yes, okay, metacarpal. Or we can say, okay, metacarpals. Is okay, the S mean is okay, just makes it plural. L is okay, yes, pertaining to. And carp, C-A-R-P, is mean as okay, just the word for wrist. So guys, okay, if we find this, okay, look at the wrist of a person. Now what we mean is okay, we'll have is going to be as okay. These bones, yes, okay, they will be as okay, the bones of the wrist. Now the bone that comes immediately beyond that is going to be as okay, the metacarpals. Clear? Okay. So guys, anatomically, you guys may say, yes, okay, this is my wrist. Well, okay, this is your wrist joint. This is your wrist joint. But anatomically, this area here, that is your wrist. So what we actually have here is, okay, is a total of 8 bones. These bones will be called the carpal bones. And okay, that's what you have here, 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 and here is going to be your metacarpals. Why do we call them the metacarpals? Mean yes, okay, just because they come beyond the carpals. Did that make sense? So carpal is wrist. Just think of carpal tunnel syndrome. You may have heard or know somebody, yes, okay, who have carpal tunnel syndrome, or you know somebody who knows somebody who knows somebody who has it. Did that make sense? Now then we can just say, yes, okay, if we have, okay, yes, bones beyond the carpal bones, and we call those the metacarpals, mainly because a carpal means wrist, yes, okay. We also have, yes, okay, let's say, yes, okay, other bones. Which we will call tarsals. And again, yes, okay, we have the L is again going to be, yes, okay, our favorite pertaining to. We can say, yes, okay, plural. And where the meta is mean, yes, okay, just going to, yes, okay, be beyond that. But the question then, okay, what is a tarsal? A tars is going to be, yes, okay, the ankle. So these will be your tarsal bones, and the bones that you have beyond those will be the metatarsals. Okay, and beyond, yes, okay, your metatarsals is going to be, yes, okay, the bones of your fingers and of your toes. But those will not be metatarsals or metacarpals. They will become they will be collectively as okay or simplified as what the hell do you call that fellow? Phalanges. Phalanges is more than one. Phalanx is one. Did you guys get that?
Yes.
Good. Our next word is new. Now, new here is actually that's okay, just what became the word new in English. Is that clear? So what is okay back in the days was new became new. Now you may see as okay a word neo. Plastic. Maybe then can say as okay here is okay the word new or new is just new. Ik is okay as that's okay or theory is okay pertaining to. And plast. That's okay here. This is not going to just okay mean that's okay. What do you want to call it? What was it? Repair. Well, mainly that's okay is going to come from the word that we talked about earlier, plasia. Plasia. Okay. So guys, new plastic. Or you can even say it's okay, you in that case. That's okay with that case. Neoplasm. It's mainly as okay, just another word that mainly as okay would just refer to cancers. Is that clear?
Did you say cancers?
Yes.
Okay.
And that mainly as okay tells us okay as what the initial explanation of cancer was. But still not explained what the happens. But generally it's okay what they is okay. Initially it's okay called a neoplasm, which we know is okay more characterized as a cancer. Is the start of a new growth. Okay, yeah, okay, yes. And what kind of growth is that going to be? Not trophic, but okay, that the number of cells increase. So it starts with okay as a change in one cell. That cell divides into two, become 4, become 8, become 16, 33, 64, and so on so. Clear? So it's a growth that's okay as one started. It's a new growth that one started, that's okay, continues. Did you guys get that? So if you see the word neoplasm or neoplastic, it will refer to, I mean, it's okay, that's going to be another term for it's okay, work can be okay characterized as being a cancer.
So both of them are considered cancers.
Yeah.
Okay.
Neoplastic or neoplasm. Okay, plastic is just going to go to be pertaining to the plasm, which is as from neoplasia that we had in previous or before the break. And what happened in plasia? Increase in the number of cells, right? Did you guys get that?
Yes.
Good, yeah. Now we can take another new. Are you yes okay? Yes okay. Just put as another prefix in front of as neoplasm or neoplastic, for instance. You can say it's anti-neoplastic. What would that be? Anti-cancers. What? Drugs. So anti-neoplastic drugs is mean yes what you also get says anti-cancerous drugs are drugs that mean is used to treat cancers. Right, okay. Now you may say, why do they call it neoplastic? Because they may say, this is something new. We didn't see it last time. Where the hell did that come from? Right, okay. Now another new is what we call new. Now we can say, just take it from scratch and say it's new. Nate. Where neo is new. Nate born. So it's what you may call as newborn is a new need. And that's why it's in as what you want to call it in hospitals as in the OBGYN unit. They may have as a neonate unit that they may as will take care of as the newborns. Back in the days, they as used to mean as just call it the nursery. Okay. Now, guys, premature or full term, it doesn't really matter. A person is only considered a neonate for the first month. So it's only as for the first month of your life outside your mother's womb that we are considered as being neonate. And then you can say it's is that then something that we call that's even that's something that you can call as neonate. Oh, logic, right? Okay. Clear?
Yes.
Okay. So that's made as we can say just a subspecialty of pediatrics. Where they say, well, okay, I'm not dealing with, okay, yes, you're 3-year-old or 12-year-old or something like that. No, I'm only as okay. Okay, we only deal with, okay, yes, matters of, okay, yes, newly as, okay, firstborn or newborns. Okay. Now, please, guys, please, 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 don't say so does this one here just mu a new n. Okay. Or does neonate means what is eaten by the neon? Okay. So yeah, of course that's okay. It depends upon it's okay where you break it up. Okay. Do you guys know what neon is?
Like a bright color.
Okay. Isn't it also what the SOK usually call those lights that they put on display in the windows? So you're eaten by that, that makes you a neonate? No. Okay. Okay. Or somebody, oh, delicious, just okay, attractive color. That color makes my appetite. Let me just eat it. Guys, do you guys know what which color is okay triggers your appetite or hunger?
Is it green?
Eh. If that was the case, spinach would have been the favorite dish of most people. No. It may sound crazy, guys. Those yellowish, oranges colors, the colors of Thanksgiving. Or those colors that they use during Thanksgiving for is okay, the decoration or decor or whatever. Those are colors that is okay. They found in the study as okay, it triggers your hunger center in your brain. That may tell you that's okay why they might use that color in Dunkin' Donuts. If you ever want, okay, I'm only going to get a cup of coffee and okay, one donut. You walk in and you walk out with okay, a dozen of donuts. Probably not, but like okay, okay. They might not have done that intentionally because this is a okay, relatively it's okay recent study that okay has confirmed that or showed that, or you can say it's okay a meta-analysis. This is as okay as analysis beyond the regular analysis. Right? Okay. Any question, guys?
Nope.
Nope. Okay. See. Now, guys, let's see. Para. And okay, that's what I mean. Yes, okay, usually do is I say, okay, this word para here. Actually, it's okay, gave rise to, yes, okay, the English term parallel. And pretty much, okay, as will tell you, yes, okay, what para is. So what does it mean to be parallel?
Side by side is parallel, right? Or
Oh.
yeah.
Okay. There's more to it.
In a straight line.
Okay, they can still curve. Guys, they will never cross. Two things, three things, four things, seven things that run parallel. Well, okay, they don't have to be in straight lines. They can curve. They can turn. But what they can't do is they can't cross one another. Did that make sense? Okay. Then you can say, it's okay, we are walking side by side. You're walking on your line, I'm walking on my line. And we just follow those lines, and okay, yes, we're never going to cross one another. You're not going to go on my track, I'm not going to get on your track. Okay, guys? So keep that parallel. Well, it's okay, definition of what it means to be, it's okay, parallel, and now usually it's okay, we may use the word para here, but okay, I just told you it's okay. From the word para, it gave rise to the English word parallel. Just like pari, periphery. Okay, your word periphery in English actually comes from pari, which is the surrounding. And you can say it's okay, being beside, being next to it, near, along the side of it, that's okay, would be para. Now, guys, well, not really as okay, parallel to it. But okay, as we say, it's okay, we have a gland, and we call this gland here, it's okay, the thyroid gland. And okay, if we can mean it says okay, mainly because okay, they say okay, a para could also mean near. So near to the thyroid gland, actually it's okay, right underneath it. Do you have it's okay, 6 or 4 it's okay, small glands. Which means it's okay, we'll just call it okay, the para thyroid glands. Now, the reason that they were called the parathyroid glands, I mean, it's okay based on their location. Yeah, because it's okay, that was near or close by to the thyroid glands. Did that make sense?
Yeah.
Right, okay. Now, yes, okay, the next word, and it's okay, an English word. Paralysis. So it's not every time that okay, as a word means that's okay, what you may think. Because if you look at it, you may say, okay, parallel is okay as alongside, near, or close, or so and so. And lysis, that's okay, so that's okay, oh yes, like a process of breakdown. Right, okay. Nah. This here actually is okay, come from yes, okay, the Greek word which is going to be as okay, paralyticus, which is what we as okay in medical term call plagia. Did you guys get that?
Yep.
Good. Hey guys. Now, does anybody have any questions about Perry?
No.
Nope.
Good. Can somebody name some Perrys?
The periosteum.
Okay, ostium. Okay, good. Okay. Now we're well, not really. Yes, okay. It's made as okay, just a sheet of membrane that okay, yes, covers the bone. So we may talk a little bit about that when we get to the yes, okay, skeletal system. We can also yes, okay, say peritoneum, right? Okay. We could say yes, okay, pericardium. They could say it's okay, perianal or perianal or perianal. Or what we also is okay, call is okay, the perineum. Right, okay. Now, guys, any questions about poly?
Nope.
A lot or many, right? Okay. So what was polycythemia?
A lot of blood cells.
Which blood cells?
Red.
Red. Because, okay, if the white blood cells were increased, that was what we called
Leukocytosis.
leukocytosis. Exactly. Okay. Okay. Now we said polyuria. What was polyuria? A lot of
Urine.
urine or pee a lot, right? So urea would in this instance yes, okay, means Dr. Tracy. Urea. URIA. Oops. URIA means what? What does the IA tell you? It's a condition of UR,
Oh, yeah.
which is
and
PP.
Yeah.
Okay, and a condition of the PP where you produce a lot of PP is going to be called polyuria. And then we have as okay, what you call as okay, polydipsia.
A lot of thirst.
a lot of thirst, or you can say it's okay, drinking a lot, right? Okay. Both is correct, but practically, yes, okay, actually, it's okay, it means, yes, okay, a lot of thirst. And then, okay, yes. Post. What does post mean?
Behind.
Behind. Okay. What else?
Back.
Back. Okay.
After.
After. Okay. Behind is only if it's okay as a positional term or directional term, right? Okay. And then we say it's okay after. What else does the word post mean?
Male.
Okay, here you go. Somebody remember that. Okay, good. Now, let's see. Now we can say it's okay. Post. This is not your piece of mail, but it's okay. We can say it's okay. It will be after. You can say it's okay. Partum. The here is okay. Me as okay. This becomes okay as the name of something. The word part here is okay. It doesn't mean it's okay. The part of the show or something, or part of the cake or something. Was birth. And strangely enough, there's something that they call okay postpartum depression or postpartum depression. Have any of you ever wondered why? It should have been yes, okay, a time of joy.
Because it's a rush of hormones.
Sum it up.
It's a rush of hormones that drastically change.
Exactly. So it's more or less okay, the hormones. Okay. But it's okay. In worst case scenario, it's okay. It can get so it's okay. It can get out of control to the level that okay, they actually just okay won't allow the child to be with the mother because they may end up okay, yes. So not just kill the baby, but yes, okay. In worst case scenarios, okay, try to commit suicide. No, well, okay. But if somebody is okay, not necessarily it's okay, committed suicide, but it's okay if somebody is found dead in okay, suspicious circumstances, it may be required to do yes, okay, what we can call is okay, a post, which again is okay, is going to be as okay after. But here we go, yes, okay, and say mortem. Okay, where okay, the mort here actually is okay, come from the word morse, which means death. And what do they do after that? Examination. Right, okay. What would they most likely is okay doing during this post-mortem examination?
Check for a cause of death.
And take autopsies, right? Okay, but it's something that's going to just okay be conducted after death. Now, yes, okay. Even before, yes, okay, going on with actual physical, with the actual, yes, okay, examination of, okay, yes, taking biopsies. They may, yes, okay, they may be able to say, okay, this person here has been dead for at least, let's say, yes, okay, 10 hours, 12 hours, 20 hours a week, so and so and so. Okay. But one of okay, the first changes that happens to the body is what they actually is okay call rigor. And okay, as from this mort here comes mortis. Which means okay, we can say okay, yeah, it's okay, we pertaining to the death. And what is rigor?
Isn't
Well,
that
okay,
Is that stiff?
exactly. Rigid or stiffness. So the person turns stiff. But that stiffness is okay, after that is going to be referred to as rigor mortis. Did you guys get that?
Yep.
What else can we have? Pre. Now just the opposite of post. Because we can say it's okay, mainly it's okay before. Now that means it's okay, just two pre's that I may talk about or briefly mention. But if you look at it, it's going to it's okay be pre, which means it's okay, just means before. Hypertension. Yeah, okay, guys, this hypertension is okay, mean it's okay, that's mean it's okay. High blood pressure. So they actually are okay as there actually is okay as a level of blood pressure. And they will say, well, okay, as you're still about the normal, but you're not characterized as being hypertensive yet. And that's when they says, okay, it's still reversible. You're in that pre-hypertensive phase. But if you carry on like nothing is happening, you actually, it's okay, will proceed towards getting hypertensive. So that's me as okay, that zone where they say, okay, clinically, it's okay, you're not characterized as hypertensive yet. But if you continue living the lifestyle that you have been doing, yes, okay, it will get to that point. So that okay, time off, okay, yes. There you can make a U-turn. So yes, okay, since we had something that we call yes, okay, hypertensive, like pre-hypertensive, yes, okay, there's also going to be something that we'll refer to as being pre-diabetic. But okay, they will say, okay, well, your blood sugar levels are not to the level right now that we can say that you are diabetic. But they are about, yes, okay, the normal range. So you're still in this level, yes, okay, where you're not diabetic yet, but it may end up there if you don't take care. Did you guys get that?
Yes.
Yes, okay, they may also, as you can see, it's okay, precancerous. Right. That's most likely as okay, well, they may as okay hold you in a tightrope. It's not cancerous, that's okay, but that's okay. Being precancerous, okay, I mean, it's okay, that's going to just okay, increase the risk of, okay, yes, a possible development of the cancer. Now, another word that okay, yes, may, yes, okay, mean the same as pre is pro, which okay, yes, can be before. Oh, yes, okay, in many cases, okay, also, yes, okay, forward. But the main term that we is okay, I mean, I think it's okay, yes, left is going to, yes, okay, what we call is okay, a prolapse. Yeah, lapse mean it's okay, just means sliding. Sliding where? Forward. Or sliding ahead. Now, I guess yes, okay, in your book, yes, okay, they give you yes, okay, a picture of okay, what they call yes, okay, uterine prolapse. Okay, but what you actually is okay, you may see that okay, yes, the uterus. Now, normally it's okay, would have been yes, okay, somewhere like this. Well, yes, okay, where actually is okay, may slide into the vagina like this. And God forbid, yes, okay, in worst case scenarios, okay, the part is okay, this part is okay, may is okay, protrude out of the vagina. Okay, you may actually say, okay, yes, the vagina actually is okay, makes a huge turn on itself because it's being yes, okay, pulled down. But mainly because okay, this is okay, trying to prolapse or slide ahead or forward. Okay. Now, guys, this may also is okay happen to is okay to the rectum. That okay, yes, the rectum actually is okay. May also is okay. Slide forward or prolapse. And okay, yes, B is okay, protruding out of the anus like that. So that would be as okay, a rectal prolapse. You may have heard of, okay, as what they call as, okay, a discus prolapse. Now, what mainly as, okay, may happen, and okay, as in a discus prolapse is, okay, as this is your disc. Now, mainly as, okay, what happens is, okay, that the space between is, okay, the two vertebrae here is, okay, decreases. That's what what we clinically call a discus prolapse. The phenomena is, okay, where the disc is, okay, slides out or protrudes like this, is going to be as, okay, what they call is, okay, a herniated disc. Did you guys get that?
Yeah.
Yes.
Okay. Any questions, guys?
No.
Okay. Nobody wants to ask, okay, how do you correct something like this? You slowly just milk it back up or back in.
You push it back in?
Well, okay, not like this. Or I milk it. I mean, I say milk it, yes, okay. Now, yes, okay, you have to be country girls. I've been living in the country to know, yes, okay, how do you milk a cow? Kids. But yes, okay, you're not going to be pulling, you're not going to say, okay, 2 inch of rectum prolapse, okay, let me just get the remaining, okay, let's take out the whole colon. And okay, yes, the small intestine. Okay, don't get into that magician move that, okay, that he pulls out that different color, yes, okay. Okay. Barali, yes, okay, milk it. Okay. So it's okay, me is okay from the bottom and okay, yes, just slowly push it up. But not like this. Okay, guys. Quadrilaps, retrovidan, subvidan. Sin. Because it's okay, what is sin? Not a sin that you commit. Okay, but this sin. Together. You may think of, okay, yes, synchronize. If you synchronize as, okay, data from one platform to another, you bring those, or you bring that data together in one spot, right? Right?
Yes.
Right.
Okay, guys. Now there's something that we used to call syndromes. And what are syndromes? Well, okay, they're mainly as, okay, just because it's okay bringing together of okay as most instances okay is haphazard signs and symptoms. Whereas okay in some cases okay even multiple diseases are brought together and called syndrome. Okay. Now an example of what is a syndrome is what we call AIDS. Whereas okay in this case yes okay the letter S stands for syndrome. Okay. We may talk a bit about yes, okay, AIDS and okay, yes, immunity or lymphatic system. And okay, yes, in patient care. Now there's going to be yes, okay, an anatomical yes, okay, important term. And that's what we will call a synapse. Together we can yes, okay, join. And what that is going to be yes, okay, mainly going to be yes, okay, where two nerves join. That can be called a synapse. A synapse can also be as okay where a nerve joins a muscle. So that junction point is okay where they come together. Can also be referred to as a synapse. Okay, guys.
Yes.
Good. Now, guys, okay, I don't want to just okay use more time on medical term. Okay. Now you may say that okay, the syllabus says okay, chapter 5. Now, chapter 5 doesn't mean it's okay, just one list of the specialties on a table. And where do you find that? Not really table, yes, okay. You may find it on the first or second page in chapter 5. But I think we have pretty much okay as runningly been talking about these as we went through different terms, right? Urologies, iatrics, okay, so on so. So that's all. Now, guys, on Monday, sorry, you guys are off. On Tuesday, we will start off with. I hope all of you have okay as a book that looks something like this. Okay, so that's what we will be talking about from Tuesday. And some of you go, okay, Mike, which chapter are you going to start off with? Chapter 1. Now, a lot of it is more going as okay, just be as okay. Things that we have talked about as okay in chapter 3. Or 2, sorry. In yes, okay. Medical term. Okay, but we're going to go as okay a little bit more aggressive. A little more as okay further details. Okay, guys.
So we're all done with terminology?
Yes.
Oh.
So
Okay.
just like you want us to look at obviously chapter 5 and like if we do the book work part for that, we should be
Well,
fine.
okay, in chapter 5, my dear, I just told you, okay, that list of, okay, as medical specialists, that's all.
Okay.
But as I says, okay, we're running this, okay, have been talking about it
Right.
as we did all logies and boos. Okay, guys. So yes, okay, from Monday on, Tuesday, we'll be talking anatomy physiology. Okay, guys. Now, all the best, and okay, at least try to just okay go through this, okay, these 2 chapters that we just did. And okay, as if somebody still have any questions, that's okay. Please free to ask. Okay. Okay, guys. Then I guess I see you guys back on Tuesday then.
Have a good weekend.
Okay.
Bye.
So do you.
Have a good
Okay. Okay. So do you. Bye.